All right, I'm Anthony Caruso from Technique Peak, and today we're going to look at upper limb tension testing, specifically upper limb tension test 1A, which is for the median nerve. So I like to have the patient positioned in supine, no pillow, so it's easy to recreate in the future. So first thing I like to do, depress the scapula, and then make a fist and hold the scapula down to the table. And then next motion will be into abduction. You want to get to 90 degrees here. Then we start to externally rotate to 90 degrees. Once they're there, I like to go into wrist extension, holding the fingers and thumb as well. Then we rotate, go into supination. Then we start to extend the elbow, looking for recreation of symptoms. Once we see that the patient is having that numbness and tingling sensation, we like to record the degree of elbow extension to try and, record your outcomes, see if it's getting better or worse in the future. That's it from Anthony from Technique Peak.